I am here with Shannon Sauer-Zavala, a professor at the University of Kentucky, and we are talking about personality change. So first question is, why is it a good idea to change your personality?
The answer is it depends, as are most things that have to do with psychology and human nature. I think for me, usually when I'm working with people, I suggest personality change or will provide techniques for personality change when there's something that's getting in the way of a client living in accordance with their values, with a particular goal that they have. So I think it's really important to say right off the bat that I don't personally think that there is a particular level of each personality trait that's like ideal and that everyone should strive for. I think that there are certain personality traits that get in the way of certain types of relationships or, certain career paths. And if that's the case, then a person would have the motivation to change. So, for instance, like, whenever I talk about personality change, I will frequently get added in the comments by the introverts, right? The introverts are having a bit of a revolution, right? With like
Yes.
quiet and all of that. And so, my stance on this is like, if you're introverted and you get energized by reading your book and you have a few close friends and that's working for you and it's not getting in the way, like, by all means, do not change. Like, I don't think it's better to be extroverted. And frankly, being too extroverted is kind of a problem because then you suck all the air out of the room and people don't really like that either. So I don't think that there's a personality level for each trait that is like ideal or optimal. And whether or not someone decides that they want to change, it has to be for a good reason because it's not easy.
Right, right. Okay. So it's if you have some value or something in your life that you want that your current traits are standing in the way of, so
Correct.
to speak. Okay. So I first got interested in your work because I learned about the Unified Protocol. So maybe you can walk me through what the Unified Protocol is and why does it have such a sexy name? Just kidding.
That's funny. So, the Unified Protocol is a transdiagnostic treatment for anxiety, depression, and other emotional disorders. And transdiagnostic means that you can use it across many problems that people have relating to their emotions. And so, in another way to say that is it's a treatment for neuroticism. The gold standard in treating anxiety disorders, depression, eating disorders, really like up until maybe 10 years ago, is what we would call disorder specific protocols. And essentially, what that means is that, like, if you have generalized anxiety disorder, you're a worrier, there's a treatment for that. If you have panic disorder, there's treatment for that. If you have depression, there's treatment for that. So they really narrowly focus on each of these single diagnoses. The problem with that is that's not how people present in reality. So most people have more than one condition. It's like rates of like 75% co-occurrence. So like if you have one anxiety disorder, it's pretty likely you at least have symptoms of another one. And so if you have GAD and panic, like, how are you going to choose which one is the most important to treat? So that's kind of problematic. The other issue is that people that are providing therapy are really busy. They're working in clinics where they are seeing, 7 patients a day, 5 days a week. And so it really isn't feasible to be up to speed on every protocol for every like problem that could walk through the door. Rather than play whack-a-mole with the different symptoms, the unified protocol, the idea is that by targeting neuroticism, the personality trait that puts people at risk for these different disorders, we can more efficiently treat patients and we reduce clinician burden so that they are more likely to use evidence-based care.
Yeah, I rarely meet someone who's like, I just have social anxiety and I don't have any other problems. Like I'm totally fine in every other way. And it definitely
Yeah.
applies to me too. Like anytime I have a doctor's appointment, they're like, any problems with anxiety? And I'm like, yeah. And they're like, any problems with depression? And I'm like, also yes. So yeah, that totally makes sense. So what is the difference between having depression and anxiety um, and having a high degree of neuroticism, or is there a difference?
There's a difference for sure. So I am a person. Well, okay. So neuroticism is the tendency to experience negative emotions, right? It's just your propensity to be emotionally sensitive. It doesn't have to be a bad thing, right? This is another one of those traits that, you think that like universally across the board, it would be a good idea to be the actual like other side of the pole is called emotional stability. But being too emotionally stable means that you're pretty even keel, and that can cause problems in relationships because maybe your partner comes home and is like, this thing happened, and you don't respond because
Mhm.
you don't have an emotional response, and then they feel not supported. So that's a little aside to say it's not neuroticism doesn't necessarily equal clinical disorder. I, for instance, would describe myself as a neurotic person, and I think it makes me a better therapist. I'm way more empathetic because I know what it feels like. Experiencing a clinical disorder, the distinction that we make is if the symptoms or the changes that are happening in your life are interfering with how you want to live. And so, for anxiety disorders, it's not just that you feel anxiety, it's that you make changes to your life. So maybe you start checking to make sure that, there's no typos in your email. And then, I don't know, then you check again and again. And all of a sudden, it takes you, 35 minutes to send a 2-line email, right? That's where we're starting to see what we'd call impairment. Um, with like panic attacks, for instance, like 80% of people will have at least one panic attack in their life. Um, but the prevalence of panic disorder is like 4% of the population. So, like, what's the deal? And the deal is that people who experience that rush of negative emotions and go on to develop panic attacks evaluate their emotions really negatively. Like, "Ugh, I shouldn't feel this way. It's weak to feel this way." And that
Mhm.
leads to avoidance. So, you don't go to the supermarket anymore, or you won't take the elevator, or you won't go to like wide open spaces because you're afraid, or you won't fly because you're afraid you won't have a panic attack. So, neuroticism just straight up means you're sensitive. You're prone to experience negative emotions. And importantly, neuroticism and extroversion, which is not just sociability, but is also positivity, right? They're on completely different poles or on completely different continua. So you can be a person that experiences your negative emotions strongly, quickly. You could be a person that experiences your positive emotions like that too.
Okay, okay, so it's okay, so you're not just, like, always a negative Nancy, you can be a positive Percy, I don't know. Okay, so what I thought was cool about the Unified Protocol when we talked is that it has different kind of strategies that people can use to deal with their negative emotions,
Yeah.
to start to think differently about their emotions or just the things that happen to them. And you talked about CBT, mindfulness, and exposures, and I might be missing even some. So, can you talk about the different elements of it and how they all come together to help people with neuroticism?
So the unified protocol is based in CBT principles or cognitive behavioral principles. And we spend a lot of time at the beginning helping people understand like why people have evolved to have emotions, why emotions are actually adaptive, why we wouldn't want to get rid of them. And that can be really powerful for people. We spend a lot of time too talking about really the calculus of long and short term consequences when it comes to how we respond to our emotions. People are, designed to maximize pleasure and minimize pain. And so when we are anxious about something and we can text our partner and ask for reassurance and then we feel better for 30 seconds, that's reinforcing because we get that relief. And so really helping people understand, I think this is like, bring some self-compassion, right? Helping people understand why they're doing what they're doing is useful because a lot of people think if you beat yourself up for doing it, you'll stop. And actually that is couldn't be farther from the truth. So there's the short-term consequences. But then we contrast that with the long-term consequence. Okay, well, if you have to text your partner for reassurance, oh, you still love me, right? Like that's gonna over time confirm the belief that your relationship is on shaky ground, right? It's gonna make you more anxious because why else are you checking? And
Mhm.
so we really help people. We spend a lot of time on the buy-in, emotions, maybe uncomfortable, really important. We don't want to get rid of them, and how actually getting rid of them or trying to is contributing to the problem that you have. And so then after that, we do mindfulness. So mindfulness is non-judgmental, present focused attention. And, essentially we do some meditation to help people kind of get their feet wet with what that quality of attention feels like because, as you might expect, people are judgy and they think a lot about the past and the future. So we really have to like kind of train that mental muscle. And the way that it applies to emotions is like a lot of times we think when we're experiencing an emotion, this is going to last forever. I can't stand this. This is so terrible, right? And so or like something bad is going to happen in the future. And so really kind of bringing our attention back to what's right in front of us. Then we spend a lot of time too, in the same way that we talk about how we've evolved to have emotions and that we don't want to get rid of them, like automatic thinking, even negative thinking, it's like evolutionarily fit, right? So, like, we want to be attuned to threat so that we can stay alive, right? Or at least historically. And also, if we had to really think about, like, weigh the evidence for every single thing that we did, we'd probably still be in bed. You don't see a stoplight turn red and think, oh, maybe that means I should stop, or maybe it means there's a sale on jam at the grocery store, right? Having automatic thoughts is part of human nature. Just in emotional situations, that can cause problems. And so helping people systematically identify their thoughts and subjecting them to challenging questions. I mean, it's so simple, but it's like, do you know for certain that because your boss wants to see you, that you're in trouble? Could there be any other possibilities? And then we'll do probability, right? Okay, so your boss has asked to see you 100 times. How many times have you been in trouble? Oh, never? Huh. Those are the kind of conversations that we're doing in the cognitive part. And then the most powerful part of the unified protocol is behavior change. And there's no better way to show that emotions aren't dangerous, that you can tolerate them, that they're just a part of being alive, is by deliberately bringing them on purpose. And that's exposure, right? Like choosing situations that are in line with our values, right? So if I want to have a job that requires me to speak in meetings or to give presentations, then I got to get cool with public speaking, right? And so an exposure would be to public speak, maybe for our friends, maybe for a bunch of therapists at the practice, and kind of work up a hierarchy until we learn that I can do things even when I feel anxious, because a lot of times people are like, well, if I'm anxious, then I won't be able to do it. And that's like not a thing. You can do lots of stuff when you're anxious. It's not ideal or it doesn't feel great, but you could do it. And that like the bad stuff that you're imagining happening doesn't actually happen.
That's what I had to do for public speaking because I was very afraid of it, and then I had to do it for my job, and then I just was like, I'm gonna feel anxious and do it and see what happens.
I always use public speaking as an example because it's pretty universal. You don't have social anxiety to be nervous public speaking. It's high stakes, and most of us don't have the experience. A lot of experience doing that. So
No, what I think is interesting about what you just described is that I think often when people think of therapy, they think of someone who is going to have a lot of positive regard, obviously, and that sometimes that will almost extend to validating whatever they feel or say. So if they're like, I think my boss hates me because he's always asking to see me. I think a kind of a cliched, maybe, or, probably incorrect view of therapy is like, um, oh, yeah, you feel like your boss really hates you. Have you thought about looking for a new job? You talk about why you don't really do it that way.
what you described is called supportive counseling, right? So it's like somebody that comes in and they get validated, right? They can vent and the therapist can be like, that makes sense that you were mad about that. And it feels awesome. And I do some of that too. It's not that I'm just like, oh, no, you're thinking about that wrong. But for people that have interfering clinical problems like an anxiety disorder, like anxiety disorders of the disorders that people can have, they are super treatable. 12-week structured protocol, and you don't have an anxiety disorder anymore. It can be really life-changing. And so, venting about your worries, even though it makes you feel good in the short term, it doesn't actually change anything in the long run, right? And so really, like, when we want to have different results, we have to do something different, and that often makes us feel worse in the short term.
Yeah, it's true. So what is the middle ground between beneficial and non-beneficial anxiety? Because I do think, and this was me for a lot of when I was working on my book and kind of experimenting with reducing neuroticism, I was like, well, if I didn't have anxiety, I wouldn't get anything done. Olga,
Mhm.
how do you get so much writing done? I'm anxious, you know? And so to people like former me and people who think like that, what would you say to that answer?
Yeah, that anxiety is kind of a mind fuck because there are so many good aspects of it, and that in fact, like, the probably more technical way to say this is that there's this thing called the Yerkes-Dodson curve,
Hmm.
and essentially at low levels of anxiety, performance is low because you don't care. You're, "Okay, I'm just gonna watch Netflix." And at high levels of anxiety, like really high, it can be detrimental because people are, overthinking it, like, "I'm gonna fail," you think that your competence is kind of hanging by a thread, and you're one mistake away from being found out, right? And that's a really uncomfortable place to live. But it's like the devil, and so, I'd rather be super stressed out all the time, than live with the uncertainty that if I turn something in and there's a mistake or I get in trouble or it's not for you, my your editor is like, "This isn't your usual quality," right? Like, that's worse than just being stressed out while you're writing it, like, just the specter of that.
Yeah.
That's a really reasonable fear because like, anxiety tells you that you care a lot about your work, right? Like, so it's a reasonable fear. It's also reasonable because if you've always overworked, if you've always, double checked, if you've always just like kind of been running from something, you don't have any evidence of what happens if you don't, like, if you just
Yeah.
do a good job. And so my favorite exposure for working with people like this, is I call it do 80% of your best job. Like,
Hmm.
what is 80% of your best job? Do that. It's so uncomfortable. Send an email with a typo. That's another one that we do.
My palms are sweaty just thinking about
I
that.
know.
I'm getting, is it hot in your yeah. Wow. Okay, because that'll show you that the world does not collapse
Yes,
when you
like,
make a
it's
mistake.
so anticlimactic every single time. Literally nothing happens. Nobody notices because your 80% is everybody else's 100%, right? Like, nobody notices.
Hmm.
So it's a really powerful learning experience. I like to use the label behavioral experiment because it's let's find out what happens. Like, we don't know, let's collect some data. And if it is so awful and you get in trouble, never do it again. But like, let's find out.
Okay, one of the most mind-blowing parts of our interview, which is why I wanted to talk to you again today, is I was talking to you about what to do if your worries are hypothetical, like they're not likely to happen. So it's not necessarily sending a typo and or something like that. It's like some sort of act of God. And what you actually mentioned was that you had a client who was worried about not getting a job and having to move back home and live with her parents. One of the ideas that you had for her was to actually imagine this scenario, write out like a scene almost of her like laying in her childhood bed and like staring up at the Backstreet Boys poster
Yes.
and like listening to her mom and dad argue or whatever. Like the thing is, and actually like relive this for a few pages of writing.
Mhm.
Why is that helpful? Like why would you have someone do that?
Yeah, it sounds like it wouldn't be, right? It sounds really counterintuitive. Yeah, because basically what was happening for her, to kind of give the backstory, is she would go to, like, monster.com and she
Mhm.
would look for jobs, and she would start to have these intrusive thoughts about not being able to find a job, and she would just like close her laptop and shut it down. And so the thoughts became dangerous, scary. Like, it really felt like just thinking these thoughts made it as if it was more likely for the thing to happen.
Hmm.
And so by writing this script, we get to kind of like allow yourself to feel the feelings that come up related to that. And over time, what happens with that practice, with like allowing those thoughts to be there, is they don't really pack the same emotional punch. And so over time, right, like,
Hmm.
you're letting it be there. You get used to it. It can become just a thought rather than a prediction about the impending doom of the future. And
Hmm.
so the practical piece of this is so basically we recorded it and we listened to it over and over and over again. And I would ask her SUDS, which is subjective units of distress. Basically like rate from 0 to 100 how distressed you are, and like the SUDS come down, right? That's kind of like what you're looking for when
Uh-huh.
you're in session with somebody. Um and so then so she kinda, like, habituated to those thoughts. They weren't as big and scary anymore. And then when she went to go apply for jobs, those thoughts were still there, right? But she was like, "Oh, I'm familiar with you. You don't mean that I'm moving home." And so she was able to allow the anxious thoughts to be there and do the thing that she needed to do.
Okay, so a lot of this is turning down the volume on the anxious thoughts so that you can get on with your life, basically.
Yeah, yeah, and the more you say, "Oh my gosh, these thoughts of moving home are so scary. I can't have them," the more power you give them. And then your brain is like, "What was that thing that we didn't want to think about? What was it? What was it? Oh yeah, it was that." And then you're thinking about it, right? So
Mhm.
so it actually backfires and makes you worry more than if you just, okay, like I'm having that thought because I am a person who thinks negatively as the first thought. Doesn't mean it's going to happen. It's just like how I think, and now I'm gonna let it go.
So let's move on to BPD Compass. It's something that you were working on when we first talked that I think is now more kind of in motion. So tell me about that and how it works.
When I was at Boston University and like was kind of co-developing the unified protocol, I was really immersed in this idea of treatment for neuroticism. But, if you're counting, there are still four other dimensions of personality that can confer risk for mental health conditions, right? So, like, high conscientiousness is rigid perfectionism. Low conscientiousness is ADHD and substance abuse or misuse, right? Like, low extroversion is detachment. It's depression, right? It's anhedonia. High extroversion is like, attention seeking, histrionic behaviors.
Mhm.
Oh, and like okay, I forget antagonism, right? So like, that's difficulty with trusting, right? You see elements of PTSD, elements of borderline personality disorder there. And there's all this basic science research that tells us that just as, neuroticism is the hydra you slay to treat all anxiety disorders, like that you can collapse all forms of psychopathology that we treat into the big five personality traits in the same way that the unified protocol, one treatment to rule them all, is a much more efficient way to treat disorders on the neurotic spectrum. Could we create modules to do the same things for the other dimensions of personality? So BPD has been described as high neuroticism, antagonism, so low agreeableness, and disinhibition or low conscientiousness. And BPD is also comorbid with everything. So it seemed like the perfect place for proof of concept of like a transdiagnostic, personality focused system of modules where you could develop a personalized treatment based on somebody's personality profile and pick and choose the modules that make sense. So I know you're going to ask me this later. Is this only BPD? So far, we've only studied it in BPD because it's like the perfect place to see, oh, if we target antagonism, do we see decreases in, PTSD, mistrust, right? So it's basically like a system of modules tied to the big five that can create a personalized treatment.
And and so, but people without BPD or borderline personality disorder can use it if they struggle with some of these same elements. So, like if you don't have borderline but you're low on conscientiousness, so you're very impulsive, can't get anything done, you could do the low conscientiousness module of it. Is that right?
Totally. 100%. Like we haven't everybody that we've used to treat BPD Compass with in our clinical trials so far have had BPD, but they've also had other conditions, right? So if you're depressed and you also are impulsive, right, this would work. And in my private practice, I use it with everybody because I don't know. I mean, I wrote it, so I think that it's really good.
Wait, I just realized we never defined BPD. Can you give a short layman's definition of borderline personality disorder?
borderline personality disorder. It's considered a personality disorder. I would say that it's a little bit of a misnomer because it doesn't behave like the other personality disorders. People recover. People have a lot of distress about their symptoms. It actually fits better, in my opinion, as an anxiety disorder. And I would consider it to be like interpersonal relationship anxiety disorder. Like that's kind of how I think about it. And so there's emotional symptoms. People with BPD tend to experience their emotions really strongly. One of the diagnostic criteria is increased anger, but I actually think that that's just because we don't like women. Because actually, the most because the most common emotion in BPD is anxiety. There's studies that show that.
Okay.
There's interpersonal, and BPD is more commonly diagnosed in women, and like that,
Oh,
no one likes an angry woman.
that's true.
And like men wrote those criteria in like so I have lots of thoughts about that. There's interpersonal symptoms. So this is like ups and downs in relationships, like the I'm gonna leave you before you leave me. And that's like
Oh,
antagonism. That's like, but it's not like antagonism like, picking fights. It's like antagonism like I've been hurt before and I um don't trust you, so I'm gonna leave you before you leave me kind of situation.
mm-hmm.
And then there's behavioral impulsivity, and that can look like so people with BPD, not everybody, right? But a large proportion of people with BPD engage in self-injurious behaviors like cutting, burning their skin. They're often have suicidal ideation, and then they can they're likely to engage in a range of other impulsive behaviors like binge drinking or binge eating or driving recklessly or risky sex, like all of these things that function to make you not feel.
Right. I see. I see.
Everybody
Okay.
wants to not feel.
Right. Everybody wants to not feel. I hate feelings. Just kidding. I can't.
Well, you've come around to feelings, Olga.
I
You,
believe I understand the role of feelings. They can be adaptive. You should not feel them so much that you don't do what's important to you. Um, okay. I I was wondering about some of the you mentioned antagonism and that almost like starts to, touch on agreeableness. So I actually scored low on agreeableness. I took my first personality test, and it was specifically because of trust. Like I
Mhm.
didn't trust. I had low trust in people, and then I gradually increased my trust kind of through doing some of the experiments that you talked about, which is honestly just like joining a bunch of different groups. And like I was always around people and always doing things with people. And most of the time people acted normal and
Yeah,
nice.
right?
And so I was like, oh, I can kind of trust some people, I guess.
Mhm.
Um, but it was hard. And I found that when I was talking to people who had tried to change their personality traits, that was one that they really struggled with. That like, there was one guy who's like a self-diagnosed psychopath, and he um, went through all these machinations to become less psychopathic, and it was to try to be nicer to everyone around him, but it was like killing him, and he was like so like exhausted by trying to be nice. And generally, when I looked at the research, like not a lot of people want to be more agreeable, or they don't say they do because maybe they don't realize, the benefits of it. How do you deal with that? How do you deal with like people who are like, I don't really want to be nicer to other people. I want people to be nicer to me, or who, just struggle to increase their agreeableness?
Yeah, yeah. So, the way that we do it in BPD Compass, and I should have said before, Compass stands for Cognitive Behavioral Modules for Personality Symptoms. It's pretty
Wow.
good.
So cool.
I can't take credit for that. My former graduate student, Julianne Wilner, came up with that, but I think it's pretty bad.
Amazing. I love it. It's like a German acronym.
So, the way that we do it, we talked about exposure, right, to negative emotions with the UP and this idea of you have a hypothesis about what will happen if you let yourself feel your emotions. And the only way to find out is if you let yourself feel your emotions and see what happens. And so this is the same thing. Like you have a hypothesis that like you can't count on other people to get your needs met, or that if you let your guard down, other people are going to hurt you. Um, and so we make an exposure hierarchy and we think about ways to be vulnerable that are small at first and then work your way up, right? And so a lot of times people that I work with are pretty socially isolated because they're kind of like walling themselves in, like can't get hurt if I'm not in relationships with people. But I think exactly what you're describing, then if you like one person in and they are shitty, then that's not great evidence, right? But if you like go and do a ton of stuff with a lot of different people, which is like really hard, your eggs aren't all in one basket. We also do this thing called dimensions of trust. So we have people list out important people in their lives, and then they have to rate them on like, would trust to pick them up from the airport, would trust to watch my kid, would trust to pay me back. I would trust this person to tell them something in confidence. I would trust this person to be supportive and not a jerk if I told them I was upset about something. And so often what we find, right, is that trust is not black or white, that different people in your life can fulfill different roles and you can get your needs met across a breadth of relationships, not just one. And that's been really, really helpful. Like our data suggests that agreeableness increases, and so it's pretty exciting. That's a really great question about like people that are like surly or like aren't very nice. And we spent a lot of time in so the first kind of edition of BPD Compass that we were testing had like all of these sort of trust related things. We then did some brainstorming. We had some really fun lab meetings where we were like, who are people that you just dislike because they're off-putting? Like who are the assholes in class? Like what do they do? Right? And so, they correct you for minor things that are stupid and don't matter. Came up with all of these behaviors. And we thought about like, well, what's the function of some of these behaviors? What do we think the function of that is? Well, probably you want to feel relevant, or you really want people to know that like you're cool too, or whatever it is. And then we think about that long and short-term consequence calculus, right? So like in the short term, when you're like very boastful, for instance, you might feel like, yeah, like puffed up, or, you get something out of it. But in the long run, it is off-putting to people. And so then you feel like you have to be like, no, guys, me more. There's something really reinforcing about being right or being angry, And so that's where you see some of those surly behaviors. And, you really want to think, well, at what cost?
And you do this work with regular people too, right? Not just people with BPD.
Yeah. Yeah. So in my clinical work, or in my research work, have really focused on BPD, or like when I'm doing UP study, like, transdiagnostic anxiety disorders. In my private practice and in my like coaching side of things, working with people that don't have clinical disorders, I'm sort of carving out this niche, like we joke, we call it me search, but basically it's like, high achieving, perfectionistic, people pleasing people.
Oh, I don't know anyone
Usually,
like that.
yeah,
I was kidding.
usually women, like helping them do basically like behavioral experiments and like challenging self-limiting beliefs to create some boundaries and to rest and to do things just because they're fun, not because they have to lead to something.
And do you ever get pushback? Like, so I looked at your website and it does talk about personality change. And this is something that I encountered with my book as well, because when I was like, it's about personality change, and people were like, you mean like, from having a stroke? Like people, they're like, I don't want to change my personality. Like, I want a job that is tailored to introverts or like INTJs.
Mhm.
I like my personality. I don't want to change it. I just want more friends and to be more relaxed and more organized. So I guess, like, do you ever get pushback from people who say they don't want to change their personality, and how do you guide them through that?
I mean, I can answer this in a couple ways. I mean, I'm pretty like out front with we're changing personalities over here. So people are kind of like self-selecting into the practice, and so won't get a ton of pushback there. I also, I don't know if you had this experience, but like after CBS Sunday Morning, I had probably 25, 30 emails, just people being like, wow, this is so empowering. Like, this is amazing. Like, this is so cool. It gives me so much hope. I had a woman email me. He basically was like, I saw that I was developing a personality that was really similar to my dad's when I was in high school, and I didn't want that. And so I gave myself all of these tasks that I had to do. You have to walk into the pep rally by yourself because it makes you anxious. It was amazing. So the place I get the most pushback, well, there's two. So one is that people misunderstand what personality is. They think it's their sense of humor, their values, like their tastes. And I'm like, well, I could see why you would think that. It's my essence. No,
Yeah.
it's your characteristics holistic way of thinking, feeling, and behaving. Like, it's just mental and like behavioral habits, and we change those all the time. Why not do it intentionally? And then the only other place I get pushback is the introvert revolution.
Oh, yeah. The
Which
introverts do not want to make more friends. They're like, stop
you're
telling
like,
us.
please no. But it's funny because I do have like people that I work with that are like, I want to be less introverted. I just think there's a very loud online contingent that are very much in the comments of the CBS Sunday Morning YouTube.
Yes. Quiet in person, loud online. Well, okay. My last question is a rapid fire, and it's, what's one thing people should do if they want to feel happier or more fulfilled or less anxious?
The like main and most powerful thing I suggest people do is like a values identification worksheet. You can do it by yourself. I do it with people in therapy, but essentially like understanding what's important to you, not your mother-in-law, not your boss, but understanding what's important to you will give you so much important information. It'll act as a filter for like, should I take this opportunity on? Oh, I have 20 minutes. What should I do with it? Things that will be fulfilling, will make you happy, right? Will make you feel like your life has meaning. But you got to know what's important to you.
That's amazing. Okay, I will link to the worksheet. Thank you so much for doing this. This was super fun, and yeah, I really appreciate it.